Good afternoon, friends. You are listening to EBC Radio 1170 AM Aapki Choice, and I am your host Alka. And this is the time when we have a show called Cancer Education Series. And this we want to really thank Robert Wood Johnson Barnabas Health and Cancer Institute of New Jersey. And today we have a very special guest in the studio, and we will be talking to Dr. Srigowri Kota. Dr. Sri is MSN, BA, APRN, AGNP-C, OCN, is a nurse practitioner in the Urologic Oncology Program at Rutgers Cancer Institute of New Jersey, which together with Robert Wood Johnson Barnabas Health is the state's leading cancer program and only National Cancer Institute designated comprehensive cancer center. Sri has been at Rutgers Cancer Institute since 2016. Of late, she graduated from Drexel University's Adult Nurse Practitioner Program. She has been in oncology nursing for over 16 years and has cared for patients with both solid tumors and hematologic malignancies. Sri's primary expertise is patients with genitourinary cancers and breast cancer. So with that, Sri, I welcome you on EBC Radio. How are you doing?
Thank you, Alkaji. I'm doing very well. How about yourself?
Very good. It's just a rainy day outside. Thank God we don't have snow. That's a good sign.
Not yet. Yes, that's good. And before we start, if I can clarify something, I'm a nurse practitioner, not a doctor.
Oh, okay. Sorry. All right. So we are talking to Srigowri Kota. She is a nurse practitioner. Sri, can you tell me that what are the types of genitourinary cancers are there?
Sure. Genitourinary is the broad term that's used to describe the system of organs that deal with reproduction and also excretion of urine. GU is just short for genitourinary. Among the GU cancers, prostate cancer is the most common, and other types of GU cancers include bladder, kidney, penile, and testicular.
Okay. So now what are the symptoms of these types of cancer and who is at risk?
Some of the most common symptoms of GU cancers include changes in urination and urination patterns. It could be frequency, that is when someone goes to the bathroom too many times during the day or waking up several times during the night. It could be painful urination, blood in the urine, then this is one thing that should never be ignored. Hesitancy or dribbling. Dribbling is where the flow is weak, kind of stop and go. Then urinary leakage is another common symptom. Retention. Retention is when someone is unable to empty the bladder completely. Another common symptom is lower back pain. Some of the other symptoms really depend on the kind of cancer. For example, swelling, pain in the scrotal area, rashes, lumps or bumps, pain or pressure, especially in the groin area. These are more concerning for a lower GU malignancy. Risk factors, there are increasing age, especially for prostate cancer. The older the man gets, the higher his risk becomes. Being male, that in itself is a risk. Men get more kidney and bladder cancers than women. Race, family history of cancer, previous cancer treatment, obesity, high blood pressure, smoking, which is the biggest risk for bladder cancer, exposure to certain chemicals, environmental toxins used to make dyes, paints, plastic, and metal. These are some of the more common risk factors.
Mm-hmm. So people who are surrounded around those areas, they have more risk.
They have a higher risk, yes.
Okay.
But just please remember that just because you have one of the symptoms or the risk factors does not necessarily mean you could have cancer. It only means that if a symptom is new and it's bothersome, it might be worth getting checked out.
Okay. That's good to know. So now what should the South Asian community know about these cancers?
Generally speaking, the overall risk of being diagnosed with cancer seems to be a bit lower in South Asians when we compare it to other ethnic groups. But again, this does not necessarily mean that the risk is lower for all South Asians. People with family histories of cancer, known genetic mutations, smokers and smokeless tobacco users, people that really don't have a very active lifestyle or have obesity, they need to be aware that their cancer risk is different from someone that does not have any of these risk factors. For example, a man who does not smoke, has no exposure to chemicals or toxins, leads a very healthy, active lifestyle, say his father just got diagnosed with an aggressive type of prostate cancer. That just changed his risk, the son. Now he has a first-degree relative, which is a father or a brother, and his risk went up than it was before. Doesn't mean that just because the father has it, the son will get it, but it only means that the risk is now a bit higher than before.
So now, for are clinical trials offered for the treatment of genitourinary cancers?
Yes, absolutely. At the Cancer Institute, Rutgers, we have actually a very large portfolio of clinical trials that we aim to improve cancer outcomes for patients with GU cancers. And we include all stages and all phases. We have ongoing trials that involve surgery, radiation, chemotherapy, immunotherapy, targeted therapy, and so on. And we're actually going to start a new study to survey how patients and their families talk about cancer. And this is going to focus on Gujarati-speaking patients specifically.
Wow.
So this is pretty unique and very interesting. Yeah, this is called Prostate Cancer Care Communication, PCCC, and it studies the impact of having the support person during medical appointments. So this may be of interest to our Gujarati-speaking population.
Definitely, and that is the highest number in our community, right?
Yes.
So now, Sri, what is the benefit of receiving care at the National Cancer Institute designated comprehensive cancer center like Rutgers Cancer Institute, which collaborates with experts across the state in collaboration with Robert Wood Johnson Barnabas Health?
There are about 53 NCI designated comprehensive cancer centers in the United States. New Jersey only has one, and that is the Rutgers Cancer Institute. We do have a strong network of excellent multidisciplinary teams across New Jersey, and this is an important factor to consider because most cancers may need more than one approach for treatment. For example, a patient newly diagnosed may need surgery, radiation, chemotherapy, a combination of the above, and all of these can be offered under one umbrella institution when patients come to a NCI-designated comprehensive cancer center. And we also offer other services like financial counseling, genetic counseling, nutrition, social work. These are part of what patients need when they go through treatment. And NCI centers also, they have the promise of translating the scientific knowledge and discovery into clinical trials. And eventually, these become the new treatments and standards of care. In other words, all the treatments that are available today for cancer patients, once upon a time, they were clinical trials. And that's how we move forward in medicine. Right. And, just doing clinical trials and improving outcomes, they have led to the improvement in cancer care, quality of life, and ultimately the number of cancer survivors we have today, which is increasing.
Right. Because the treatments are there and more diagnoses are happening, so you could treat them earlier.
Earlier, right.
Yes. So friends, for more information about genitourinary cancers and the Urologic Oncology Program at Rutgers Cancer Institute of New Jersey, in partnership with Robert Wood Johnson Barnabas Health, please visit rwjbh.org/beatcancer. So Sri, before I let you go and finish our talk show, I would like to know what tip you want to give to our listeners so that if they are at the risk of genitourinary cancer or, can prevent that. So what do you want to give a slight tip to our listeners?
Sure. Cancer diagnosis, can be very stressful. And there are a few things that we all need to consider just to know our risk. So the first thing is it's very important to know your personal risk for cancer. Not everyone's risk is the same. And if you have anything that's new or unusual, you know your body the best. Please see your doctor. It could be nothing, but then it could be something. It's always good to rule out. And then when it comes to risk factors specifically, there are both modifiable and non-modifiable. Non-modifiable things are things that we really cannot change. Gender, age, race, genetics. We cannot change these things. But what we can change are the risk factors like smoking, obesity, having a sedentary lifestyle. So these are something we can change.
Right.
Annual physicals are also very important because someone with chronic diseases like hypertension and diabetes, these need to be under good control. And that, promotes a healthier life. And then the most important thing is prevention. When we do have some recommended cancer screenings like mammograms, colonoscopies, PSA checks, pap smears, those are very, very important to help detect the disease very early, which, can lead to early stage diagnosis and potentially cure. So that would be my message, prevention and early detection.
Okay, very nice, Sri, because this is something a lot of time people get very ignorant and lazy to go and see their doctors or follow-up checkups and all that. So I think your message is for our listeners is to must see annually at least our doctors, and whatever, follow-up checkups they demand for, they should go for it.
Absolutely, yes.
Yes. So with that, thank you so much for coming on airwaves of EBC Radio, Shri, and educating our listeners. And thank you again, and hoping we will be talking soon with you.
Thank you. Thank you for having me. My pleasure.
Okay. Bye-bye.